Hi, everybody, and thank you for watching On Call for All Kids. Today, we're talking about everything you need to know when it comes to visiting the emergency center. We'll be discussing whether or not it's safe to go to the emergency center, how to prepare for and what to do in an emergency situation, and when to call 911 or make that trip to the hospital. I am joined by Dr. Danielle Mercurio. She is a physician in our emergency center at Johns Hopkins All Children's Hospital, and it's great to see you, Dr. Mercurio.
Hi, Ashley. Thanks so much for having me.
You got it. So first things first, is it safe to go to the EC right now?
For the most part, yes. Our EC is taking all the precautions necessary to reduce transmission of the coronavirus. With that said, most ERs are doing the same, but adult facilities will have sick adult patients there in the waiting room and throughout the ER. So if you have that time to come over to the specialized children's hospital nearby, I would take the time to do that if it's possible.
Walk us through how to prepare for emergencies. Where do we start?
Sure. So number one with preparedness is to prepare ahead of time. Let's go ahead and map out that route to the emergency room and know what it takes to get there. And if you need to take any special precautions, such as are there any detours or things like that during the pandemic, it seems like there's a lot of construction. So keep those things in mind. And then see how much longer it takes you to get to the specialized children's center. The emergency center here is available for you 24/7. So if you have the ability to get here, I'd say come here during the pandemic.
So what else can we do to prepare?
Sure. So one thing is definitely keep an extra mask for you and your child in your bag or in your car, along with some hand sanitizer, just because if you have to arrive at an emergency center, while they usually have that stuff for you, you want to have it on hand because if there's, a car accident or something, a lot of family members in the area, somebody's really sick with a heart attack, there could be excess people, and you want to be sure to keep that social distancing and maintain the safety with having that precaution in place.
Now, are there any situations or emergencies that could actually just be handled at home?
Sure. So sometimes we get nervous with our kids, and it's not fair for us to have to be the doctors, especially right now with a pandemic going on. So if your child has some belly pain, a sore throat, an earache, things like that, you can go ahead and call your pediatrician, and you can do a telemedicine visit or an in-office visit. A lot of things can be determined via the telemedicine, believe it or not. We usually have parents be the hands over the telemedicine visit. And if the pediatrician or primary doctor has any concerns about what's going on, they'll send you into us, which works perfectly. Other things like small animal bite wounds, small wounds and things like that, they can watch over time via telemedicine on the screen, and you can avoid having to come into the emergency center.
What are your thoughts on urgent care facilities?
Another great question. So urgent care facilities are available for things like ear pain that comes on suddenly, or maybe a small laceration and things like that that need to be prepared. But again, keep in mind, if it's not specific for pediatrics, there could be sick adults there that could be transmitting the virus at a higher rate than you would see in a specialized children's center.
What about those emergencies that we know cannot be taken care of at home, even though maybe there's a potential COVID risk that we're walking into?
Absolutely. So with the COVID scare, there are some people that are trying to stretch it out at home, and we've seen some ruptured appendicitis. We've seen some broken bones that need to be reset, but they're kind of waiting longer than we normally would want. We've even seen some things where children are not acting right, and it turns out that they have some sort of cancerous illness. So there are circumstances in which you must come here to the emergency center, and we want you to feel comfortable doing that. We are taking all of the precautions, as I said before. We wear these face masks here. We have shields over our face. We wear a lot of gowns and gloves and things like that just to protect us and you and your child. So please know that when you really need us, we are here and we are happy to help.
Are there any other circumstances that, we should just directly call 911 or be coming into the emergency center?
Absolutely. So there's quite a long list, but to go through a couple of them, if you have an infant that's 60 days old or less and they have a temperature that's taken rectally of 100.4 or higher, they need to directly come to the emergency room. Also, anybody that's immunocompromised, has sickle cell disease, is on chemotherapy, if they have a temperature greater than 100.4, they need to also come to the emergency room. If there's any broken bones or injuries that look deformed, they should really come into the emergency room. Again, it's perfectly safe. Abdominal pain that's lasting a long time and your pediatrician is uncomfortable. Certainly, if there's any sort of wound that's bleeding and despite pressure for 15 to 20 minutes, it's still bleeding, please come on in and we'll see you.
Dr. Mercurio, thank you so much. And thank you for all you're doing right now during this time.
Of course, we're here to help.
And thank you all for watching. If there's a topic you would like us to look into, you can comment below right here on this video. And we also have a great website. It's hopkinsallchildrens.org/coronavirus. And you'll find a lot of wonderful resources there as well. Take care. We'll see you next week.